my second degree at my own expense, but my third degree is funded by the federal government of Nigeria, courtesy of TED Fund. This I should give back to the society. Alhamdulillah, what are things that people count as what is something? Okay. By Allah's grace, what people count as important in life, you've been able to do it. Alhamdulillah, presently I reside at 10 Professor Abdulwahid Ajibola Crescent. Okay, off Ayepe Road, Shagamu, is by Allah's grace. I have children, medical school, I beat house. So the essence of going is just service, without wasting our time or burning us because we are few. As a teacher, I don't mind though. When we are seeing more than this, I can still repeat myself. But just to round up, because to save our time, the essence of coming before you this morning is to canvass for your support, because this is something that one cannot do alone. I need the support of all. And EKOBA 83, as my family, I believe that we should be carried along. You should be carried along. It will not be something that, you know, Abia Idajibola at Okemoson. Is it the same that Waidi? So I don't want it to be a surprise, because by Allah's grace, I'm an unrepentant optimist. I'm very optimistic that Allah's grace, it is Yayi Omoluabi ticket that will fly the flag of APC into Okemoson government house come 2027. We've been working, Yayi is working, my uncle said we have been working, we've been publishing in Guardian, in so many newspapers, to even convince my Egba people that Egba, it's not Egba's turn now. You have not done it before, and now they have a formidable candidate in person of Yayi. So, to round it up, what I want from us are just 2 or 3 or 4 things. First and foremost, prayer. Because I started this campaign by putting it before Allah. Last year, I was in Saudi to do Lesser Hajj Umrah, committing it to Allah. This year too, I was there to commit it to Allah. Even my wife was there. She's even still there now. At random, she goes to the Kaaba to put it before Allah, because we want to give back to the community. So I also enjoin us as individuals collectively to always remember this aspiration in your prayer and put it before God. That is number 1. Secondly, I want to canvass for the votes of each and every one of us. If we are residing outside Ogun State, it's not too much transferring your voting right to Ogun State. If you find any place convenient for you in Ogun State, be it Odogo, be it Shagam, be it any local government. I have friends in Ibadan now, my colleagues in UI, they'll be transferring their voters card to Ogun State, simply just to come and vote for Yayi and my humble self. So that's the second thing. And now the transfer of voters card is on. So you can do it on your phone, very easy. You can do it on your phone, and when the voters card is ready, just go and pick it up in the local government that you transfer to. Okay, that is the second thing. Then the third thing is, that's, I've been talking spiritually, physically, we also need finance. There is hardly any meaningful project that you cannot do without finance. I've been to national headquarters, it costs you sums. I've met the national chairman of the party. It's a function of money. We are still going to, we've been spending and we still spend more. So lastly, I want to implore us, if the president will grant me that permission, that I want to suggest that probably a 7-man committee should be formed, that we, with my humble self inclusive, that we also be relating nicely with the executive and the larger house on how we move forward. And I'm working with our IPP, and is more than willing to chair that 7-man committee. And I'm sure my person of EKOBA AKINADE ODESOLA, I spoke to him, is willing to share that political committee. And I'm sure my elder colleague will also be glad to be the secretary. So my humble self, I will be a member of the committee. So that is just what I want to say this morning. Thanks so much for granting me audience.
Thank you. That was a wonderful remark. So without wasting more at our time, let me call on Ekorian. Please come so that you ask your question. Let's go to our lecture. It's after 11. Thank you so very much. In domino. In domino, let's put our hands together again for Prof, our incoming Deputy Governor. I will be glad to participate in the committee and support financially. I will help you to raise money in the diaspora. Okay? Europe, America, I will go and campaign for you there. Don't worry. But let's go to our lecture for today. Like the VP said, Dr. Akekumi is unavoidably absent. So I got the message at around 11:30 p.m. last night, and I had to quickly put something together because we have worked so hard, especially the chairman of the occasion, Professor Akinsoya, to bring up this retreat. And, I wanted to make sure we have something. So bear with me. It's not a perfect lecture, but bear with me as much as you can. All right, first slide. This is EKOBA E83 AKINADE ODESOLA Retreat, 2025 edition. That's my credentials over there. I practice medicine in the United States and Canada. And I'm a diplomate of the American Board of Family Medicine. My specialization is emergency medicine and hospital medicine. So that's what I do. I don't have an office. I work strictly in a hospital. Next slide. Okay, so today we are going to talk about hypertension. And I'm going to try and make it as interactive as possible. And so if I point on you and call your name, please don't feel embarrassed. We're all here to learn. So I will call on Prof. Tell us what you know about hypertension first. Hypertension.
Yes, hypertension in a layman's language is what one can say emanates when you have high blood pressure, just in a layman's language.
Thank you, sir. Very simple. Hypertension. Hyper, anything hyper means high. And then tension is pressure. So high pressure. All right. We have a picture of the heart there because the heart is what? It's the pump. What does it do? Pumps blood to the rest of the body. And then working with the heart, you have vessels, which are like pipes. You know, the pipes that bring water to the bathrooms, the kitchen. Okay, they all, you know, some way connect back into the heart. You know, the blood gets pumped out to the rest of the body after it's been oxygenated in the lungs. So it goes from the lungs, it goes into the heart pumps it around. We use the nutrients in the blood to function, moving around, talking, everything, thinking. We need the nutrients in the blood. And once the nutrients have been exhausted, we need what? We need to replenish those nutrients. So they do what? They go out through the veins. The blood comes out through the arteries. Okay, they're usually thicker walled because the pressure is very high in the arteries. And then when they're going back, you know, they're sent back in the veins, right? So the pressure is less. Next slide. All right, so we'll talk about the pathophysiology of hypertension, we'll talk about prevention, and we'll talk about treatments very briefly. The objectives of this lecture is to define hypertension and distinguish it from normal blood pressure, describe key pathophysiological mechanisms, interpret the guidelines for diagnosis and classification, outline lifestyle and pharmacological management strategies, recognize complications and the importance of screening and adherence, and then discuss special populations and secondary causes. We are all special populations because we're in our 60s. Next slide, please. I think the first one has been defined by Prof. Sustained elevation of arterial blood pressure. That's hypertension. So to diagnose hypertension, you come in, we check your blood pressure, you sit, rest your back, check your blood pressure, and it's 1,000 over 900. Do you have hypertension? Do you have hypertension? No, you do not. Why? Why? Because blood pressure does this. It fluctuates. No. I led you to the answer by saying it has to be sustained. So when you come in and we check your blood pressure, if it's high, what do? We make you sit down, you relax, we check it again. Because if I do something and my wife screams at me, why did you do that? If you check my blood pressure, it's going to be high at that time. Does it mean I have hypertension? No. I've just been scolded by my wife, so, or maybe my boss, writes me up, calls me to the office and say, Dr. Lukudano, a patient complained about you. My blood pressure is expected to be high. That's a physiologic reaction. Okay? Now, make me rest, make me relax, repeat the blood pressure testing. If it's still high, then you can be diagnosed with high blood pressure. As a matter of fact, when you come to the doctor's office, if your blood pressure is elevated, you're going to come back. We're going to check it again. So it has to be sustained. That's what that is saying. And, you have some numbers there, 130/80, SBP is systolic blood pressure, and the other one is diastolic blood pressure. So that's like the benchmark. How do they collect all this information? You get a bunch of smart people, they sit in a room like this, and they said, okay, for people that have complications, most of the time their blood pressure is above this level. So they pick a number. So right now we're using 130/80. So we have different types of hypertension. We have primary or essential hypertension, and we have secondary. We call it primary if most of it is primary hypertension. In other words, there's nothing wrong. You're just getting older. The vessels have been hardened, so you develop hypertension. I think all of us will develop hypertension if we live long enough. And then secondary is hypertension through other causes, with kidney, medications, anything else can cause hypertension. Next slide. Next slide. All right, so what are the major modifiable risk factors for heart disease? For hypertension. So you have stroke, heart failure, chronic kidney disease, peripheral arterial disease, ischemic heart disease. The IHD is ischemic heart disease, basically blockage of the coronary vessels that bring blood to that big pump that we looked at. The big pump also needs nutrients. It needs oxygen, to pump the blood around our body. And the blood is supplied through the coronary vessels. Can you go back to the very first slide? So I can point it out. Okay, so you can see some vessels here that are bringing blood to the heart. Some taking away. All right, now go back to where we were before we got here. Go on. Okay, so were we here? I think you got to go back one more. All right. So, how do I know I have high blood pressure? Anybody? How would I know that I have high blood pressure?
In fact, maybe I will even ask a question to correspond with. If that's maybe my question will answer that question. If your blood pressure is 160, then another time is 130, another time is 120. Is that high blood pressure?
Thank you very much. So the question is, how do I know I have high blood pressure? How do I know that I have high blood pressure? He now threw another question at me to say, if you have 3 records with different numbers, do I have high blood pressure? I think we answered that before. We said it has to be sustained. So one measurement is not enough to diagnose high blood pressure. Okay, so if it's high, you look at the circumstances. Brother Keshiro has just scolded me. He just called me and said, Femi, you don't share or misbehave. My blood pressure is going to go up. If you check my blood pressure at that time, it's going to be elevated. But it doesn't mean I have high blood pressure. He just scolded me. There's a reason why. But if I'm sleeping, resting, relaxing with Prof, and the blood pressure is elevated consistently, you have to have multiple readings, not just one, then you have high blood pressure and it should be treated. You wanted to say something?
No, you have said it because you are asking how do you know if you have hypertension? I wanted to say stress. Stress can even cause. You understand that? Then, what about thinking? Okay, so those are the things I know generally. So when you are moving forward, I will ask questions.
Thank you. Okay.
Good morning, dear colleagues. You asked, how do we know we have high blood pressure? We can know we have high blood pressure if we have consistent headache. If you engage in strenuous job and you become restless, not sleeping most nights, then if one becomes uncomfortable when you seek for medical attention and you are tested, if that thing persists for a period of time, maybe with the thing that goes with your job and the readings is not coming down, at that point you can easily assume that you are hypertensive.
Thank you, my brother. Let's put our hands together for Ikorian Odu. So he mentioned one thing, which is one of the signs of hypertension. Most of the time is asymptomatic. That's why they call it the silent killer. My late mother, bless her soul, she had hypertension. The only symptom that mama has is putting for me, and then she'll grab the back of her head. So I see that in some patients. You know, they complain of headache, back of the head like this. But don't be deceived. Hypertension is most times silent. You don't feel anything. It's there. It's when you actually measure it that you see that it's high. Most of the time, people have a stroke. That's when we check their blood. It's very high. It is the stroke from hypertension. You know, so early detection and control reduce cardiovascular risk factor. What are the damages that can be done by hypertension? The most common ones is stroke, and you have heart attacks. But it also damages the peripheral blood vessels. It will destroy your kidneys. You know, other organs are affected, like your eyes and things like that. Next slide. Yes, sir. Okay, the question is it hereditary? There is some factor that has to be with genetics. You know, I have high blood pressure. I think I got it from my mother, who also got it from my mother. You know, but it doesn't mean 100%. In other words, my mother had 8 children. She has hypertension. Not all of us have hypertension. Thank you. Increased systemic vascular resistance. Okay, what does that say? So I said the heart is like a pump. So this is the heart. It pumps water, blood around the body. Those blood vessels are like pipes. If you narrow the diameter of the blood vessels, either through formation of plaques or anything, there is increased resistance. The heart has to work more to get the blood out, and the pressure will go up. So that's what that is talking about. Autonomic dysregulation, sympathetic overactivity. Well, I mentioned if Belakeshiro calls me and says, Femi, you are doing something wrong, or maybe my wife scolds me, you know, and I'm upset, that can make my blood pressure go up. Vascular remodeling and endothelial dysfunction. Yeah, so it's talking about the wall of the vessels. You know, damage to the wall of the blood vessels can also cause high blood pressure by increasing the resistance. Sodium and volume expansion. Anywhere, sodium is one of the minerals in the body, right? But it doesn't go alone. It likes to attract water. Prof will tell you. So anywhere you see sodium, you see water. So sodium is salt. Sodium chloride, that's salt. That's table salt. So when you like to put a lot of salt in your food, or you like to eat a lot of canned food, you know, there's a lot of salt in canned food. The sodium content in your body will be very high, and when it's high, the volume will be very high, the blood pressure will also go up. We usually tell people not to add extra salt to their food. You know, so when the cook makes the food, some of us will take the salt shakers and we do like this, sprinkle salt on it. It's not good. You know, it can worsen the situation. Alcohol, too much of it is not good. Prof, too much of it is not good. Too much of alcohol is not good. Too much of alcohol. For the ladies, 1 drink, alcoholic drink. For the gentlemen, is 1 to 2. 1 to 2 a day. And you're not allowed to combine them. So, Prof, genetic, hereditary. So that's one of the factors. And then lifestyle. You know, lifestyle, too much of alcohol, salty food, canned food, too much of it is bad. And stress in general. Mr. EKOBA there, by 8 o'clock, my brother is in bed. But some of us will keep going at 11, 12, we're still working, we're still running around. And then we sleep for 2, 3, 4 hours. We get up very early in the morning. We have to drive 2 hours to get to work, another 2 hours to come back. That's a lot of stress on our body. We have to find a way to de-stress ourselves. So that's that on physiology. Okay, there are some pictures here that helps. I guess this one is showing the blood vessel here. That's the blood pressure machine, I think. And well, this is how we try to control blood pressure. Diuresis, that's just taking the fluids out, reducing the volume. And you have some hormones that affects blood pressure. I think this is for the medical students and the residents, more than us. Next slide. So the first box there is what we say normal blood pressure should be. Okay? And then when it's between 120, 129 for the systolic and less than 80, I think we start talking about elevated systolic blood pressure between 120, 129. And then they have stages of high blood pressure, different numbers. You don't want to be here, whatever you do, because then you are in the danger zone, crisis zone. Next slide. I think I alluded to this before. In order to classify somebody as an hypertensive patient, you have to have multiple readings across 2 to 4 visits. Avoid the temptation for any doctor to put you on medication right away. You show up at the doctor's office, they check your blood pressure, you have gone through machine, you do Olosha. To get to the doctor's office, they check your blood pressure is high, and they want to give you pills. No, we have to come back. You know, we have what we call ambulatory blood pressure measurement. We actually will give you a machine, you take it home, you check it at home. When you are in your natural environment, you're comfortable, you know, because that's what we call white coat hypertension. Their blood pressure is okay at home. But the minute they see you in that lab coat, the blood pressure goes through the roof. You know, the fear of the unknown makes their blood pressure go up. So, and then they talk about proper techniques. You need to be seated, back supported, don't cross your feet, put your arm at the heart level. Caffeine, smoking, 30 minutes prior. I will include meeting your wife 30 minutes before. There's a small child here, but you know what meeting means. Correct cuff size. You know, so we have different size of our arms. So you have to get the right one. It can't be too tight and it can't be too loose. It has to be just snug. And the pipe or the tubes is somewhere here, right? The brachial area. Next slide, please. Okay, there's a picture of how it should look like. Go back to that slide. So you can see this is somebody checking their blood pressure. They're resting their arm, machine, and the tube is right there. Next slide. All right, early onset hypertension. So sometimes you see young people. You know, if you see a child like this that is hypertensive, it's usually not primary hypertension. There's usually a reason why they have it. They usually have maybe a kidney problem, endocrine problem. The most common one I can think of is pheochromocytoma, which is a tumor cancer in the brain. Not in the brain. It's actually in the adrenals. Then you have sleep apnea, renal artery stenosis. What is sleep apnea? Anybody knows what sleep apnea is? Okay, so that's when you sleep and you make a lot of noise. You know, noisy breathing. And the airway occludes while you're sleeping. You have to breathe, so you force air. You know, that's obstruction. And it becomes very noisy when you are sleeping. And then at some point, you actually stop breathing. Your brain becomes deplenished of oxygen. You know, taps you and say, "Get up, okay, get up." You get up like this. Breathe, open your mouth and breathe, and then you fall asleep again. You start to snore, Oxygen level goes down again, you wake up. Okay, so what happens is you're in bed for 8-10 hours, but out of that 8-10 hours, actual sleep may not be more than 1 or 2 hours. So you wake up, what do you feel? It feels like I've not slept. I'm so tired. You know, you're so tired. I'm so tired. You wake up very early in the morning, you're so tired. You should be doing sleep studies to make sure you don't have sleep apnea. Usually your spouse would have told you anyway, you make too much noise when you're sleeping, you know, and you should go see your doctor. You have renal artery stenosis. That's basically narrowing. You know, different things can cause that. A lot of times it's the buildup of plaques. Medications, okay? So the common ones are the cold remedies that we use, like Benadryl, Actifed, and things like that. You got to be careful. NSAIDs, non-steroidal anti-inflammatories. That's ibuprofen or ibucap. You know, that's the most common one that we use in Nigeria. You have to be careful. They can raise your blood pressure. Then you have the stimulants. You know, a lot of children nowadays are using all kinds of stimulants that can raise their blood pressure as well. Then you have the Cushing syndrome, you know, aldosteronism. This is all with the adrenal glands here. Next slide. Okay. So this is more like lifestyle to ensure that we don't get hypertension. Matter of fact, if you're diagnosed with hypertension, what is the first treatment? Anybody knows? You've been diagnosed with hypertension. You've come 2-3 times. We have checked. You have high blood pressure. So what do we do?
If I'm
you are diagnosed with high blood pressure already.
right,
So what is the first line of action? What are we doing with the patient?
you mean the
I am a
doctor?
patient.
Okay.
Sir, I'm a patient.
Right.
I come to you, my blood pressure is high. Send me home. I come back, my blood pressure is high. I go again, I come back, it's still high. What do you do for me?
I know I'm not a doctor, but I've been. But the thing as a patient, because I'm a high blood pressure patient, you know. So I know if I'm going to my doctor, there was one day like that, I didn't use my drug. So the doctor was very annoyed that why do I have to stop? That I should be using it every day. Because by the time I went, I was on admission. And I found out that my blood pressure has gone up. He said, what about my drug? I said, I stopped using it because of the malaria drugs I was. He said, no, you must be using the two simultaneously. That mustn't stop. So, I mean, if I do, it is to continue using your drugs. That's all, because I know yesterday when I went for the test and when they measured it, when the lady saw it, said, are you on drugs? I said, yes, keep on using your drugs.
Thank you, sir. So you heard what Barakashiro said. He says you have to keep using your drugs. Very important. So a lot of times, my mother, bless her soul, she takes the medication, her blood pressure gets controlled, and she said, Femi, you have to keep taking this. I said, Mommy, Alaja, it's going to come back up. So you have to keep using it because you are suppressing it. And the minute you stop, it actually goes higher than before. So that's one. What I was actually getting at was the first treatment for hypertension. So you've been diagnosed without multiple measurements of your blood pressure, and it's confirmed that you're hypertensive. So the first thing is lifestyle modifications. And what they want you to do when they say lifestyle modifications are the ones that we have listed here. What did we do this morning? Exercise. We did 1 hour gym this morning. Excellent. So what they say is, if you can get 150 minutes or more per week, you're good. And you can just do walking. You can be on your treadmill. You can lift weights. Yeah, you can do anything that makes you sweat. You know, move around. Don't stay still. The other thing is to moderate alcohol. They don't say don't take alcohol. We used to say no alcohol. But we actually did a research some time ago, and we found a little bit of alcohol actually helps. My theory is it helps because it diminishes your stress. You know, like there's 24 hours in a day. And if you take some and you're able to relax and get some sleep, it takes your worry off because you forget about your worries. You can relax, you can sleep well. That's my theory as to why we found some benefits. But if you cannot control yourself, if you're the type that once you start with one bottle, you don't leave until brewery is empty, then don't even do it. It's not worth it. So for the ladies, they say one, and for the gentlemen, they say 1 or 2, maximum 1 or 2 per day. And you're not allowed to combine them. You know, you can't say, today is Monday, I didn't drink anything. Tuesday, I didn't drink anything. Then by Saturday, you say, 2 times, doctor said 2 a day, 2 times 5. I can drink. You can't do that. So weight reduction, weight loss also helps. You see a lot of people that are obese. They go through what we call a bariatric surgery. In other words, we shorten the volume of their digestive area. So their food does not digest. It goes through fast, and they lose weight over time. So if you can lose 5 to 10% of your weight, you can actually bring down your blood pressure and control it. The next thing is salt reduction. They say 1,500 milligrams per day. You know, I just tell my patients, I say, if you eat, leave the salt that whoever made the food, leave it in the food. Don't go and shake more salt into it. Just leave it like that. And then they talk about DASH diet. You know, this is a Mediterranean diet kind of thing. You know, a lot of nuts and things like that. More white meat, more fibers. You know, so you have a bowl there. Let's say this is your plate. How about nothing jẹun? So what they have said is, you actually divide it into 2. On one side, you put vegetables, F4, and things like that, carrots, fruits, also, you know, I'll get there on one side. So that's 50% of the plate. Then on the other side, whole grains, oats and things like that. You can put that there. And then healthy protein, white meat, chicken, beef. You know, only one way. Mostly ejasha, I think. Eja. And I put you goat meat. And obviously water, omi. You have to drink a lot of water because you wash it down. You too much time to be absorbed. Next slide. Salt. I want to cross salt out, so avoid salt. So we're now going to therapeutics. So this is mostly for medical students and residents, actually, but I can touch it briefly. So on the first one, the first line, diuretics. And we use a class of diuretics that they call thiazides. You know, that helps you to pee a lot and reduce the volume of water in your body. You have the ACE, they work through your kidneys. Calcium channels blockers. You have combination therapy if they're too high. Some of my patients are on 4 medications. So you start with 1, and then you continue to check the blood pressure, and if it remains high, you add another one. If it remains high, you add another one. I am on 2 blood pressure medications every day. My mother, before she died, she was taking 4 to control the blood pressure. So whatever it takes to control it, that's what you got to do. And you have to keep taking those medications, because when you stop, the blood pressure will come back up. Next slide. Okay, this is what I just said. You start with a single agent. If you don't achieve your goal in 4 to 8 weeks, add a second agent to it. If still above goal, escalate to triple or alternate agent. And then some special populations, pregnant people, when they have high blood pressure, it's always it's very, very dangerous for them, you know. And then people with chronic kidney disease. Next slide. Okay, so if you have chronic disease, they said avoid ACE inhibitors, angiotensin receptor blocker (ARB) are preferred. Ibucap or NSAIDs, try to avoid them. If somebody has diabetes and they also have high blood pressure, then you know it's a very special case. You know, you have to find medications that will protect those vessels, because diabetes itself is a bad entity when it comes to damaging blood vessels. The elderly, you know, they're very frail, and you have to be careful in terms of how you treat high blood pressure in them, because high blood pressure is actually better for the elderly than low blood pressure. You know why? Because they tend to fall. You know, so we are a little more careful when we manage hypertension in elderly people. We tolerate higher blood pressure in elderly people than we would in younger people. And then another point I should raise is, if your blood pressure is always here, don't bring it down here suddenly. So, because some people will go to doctor and start saying, my blood pressure is still too high. You have to bring it down very, very gradually over a long period of time. You know, if your systolic always hangs around 200, if you bring it down to 120, you faint, you pass out, because your brain is used to such a high pressure. It requires such a high pressure to perfuse it. And so if you bring it down to 120 from 200, that person is going to faint, is going to pass out. So when they come to the hospital, we usually reduce it by 10%. Another 10%, another 10% over 48 hours until you get it to the goal. So it says personalize the target. Pregnancy, avoid ACE, your doctor will know that. You can use labetalol, nifedipine, or methyl-dopa. Anybody taking any of these drugs already? I am on this one, the ARB, and then I also take something similar to this. I take Novask and Avapro, ibuprofen. Black population, these are all of us. We respond very well to thiazides and the calcium channel blockers, which is what amlodipine or Novask is. You know, anybody taking amlodipine or Novask? Amlodipine, okay. I'm also on that. My mother took that as well. They're good for black people. Black people respond to it. But if you're on the thiazide, you just got to make sure you hydrate yourself, because we are in an environment where we do what? We sweat a lot. You can see I'm sweating. And as we are sweating, we are getting dehydrated. So if you're also taking those diuretics, like that thiazide, you have to drink water. You know, be drinking water. Because you have medication taking it away, and the weather also taking fluid away from your body. You can become dehydrated very easily. Next slide, please. Okay. We talk about the crisis with high blood pressure, and we call one urgency. In other words, it's very high, so it's urgent. Or we call it emergency. What's the difference? So if it's an urgent hypertensive urgency, we can still use oral medication, pills. Okay? But when you get to the emergency, hypertensive emergency, then we use IV drugs usually. And the difference between both of them is, once you get to the emergency part, you already have what they call end organ. That is the organ that the blood supply is going to damage. Your kidneys, your eyes, they're already getting damaged. So you got to move fast to lower your blood pressure. And typically we'll put them in the ICU, and that's intensive care unit. Next slide. All right, so this is just it's a reminder on the different organs that we have in our body. You know, so this is the intestine, the spleen, the eyes, brain. I mean, you can see it, they're self-explanatory. And that pump in the middle, the heart, supplies all these organs. They depend on it. And if it does not function well, all these organs can be affected. You know, and when they are affected, they present in different ways. But probably the most common ones is heart attacks and strokes. You know, that's what we see with hypertension. But we also see kidney failure, and people develop chronic kidney disease. Talks about retinopathy, that people getting blind, kidney failure. You have peripheral arterial disease or aneurysms. What are aneurysms? Anybody know? Aneurysms. Okay, so that's a defect in the wall of the blood vessels. They bulge out, and if they stretch enough, they can burst and bleed. If it's in the brain, you get a stroke. And heart failure, heart attacks, and strokes. Those are cardiovascular complications of hypertension. Next slide. Yeah, so follow up every 1 to 3 months and try to get the machine. Invest in this machine. If you have any friend in the diaspora, tell them when you're coming back, bring this for me. All of us. We should be checking our blood pressure at home. EKOBA E83 actually has 2 of these machines that were donated to us by one of our brothers in the diaspora, a Korean Chooks Asubo. Your medications are very important. And you watch out for the effect. And things like that. Hydration. Minimize the amount of alcohol you take. Check your cholesterol. You know, check your glucose. Quit smoking. Your BMI. That's about weight. Next slide. Okay, personalized targets by risk, comorbidities, and age. You know, I mean, I'm a lot older than this young man here. So the risk that I have, he doesn't have. You know? So that's what that is talking about. Minimize polypharmacy if possible. Before you add any medications to the one prescribed by your physician, please take it to them, including all the herbs. All these yalagbu and things they carry can actually affect and interact with the blood pressure medication, so you have to be very careful. Some of them can make it stronger, some of them can make it weaker. So just bring it to the doctor before you start taking them. Okay. Consider fixed dose combinations. I think this is more for the doctors and the residents to make sure that for compliance and adherence, you know, once a day is better than twice a day. You know, so if you have 2 drugs, this one you have to take it twice a day or 3 times a day, and the other one is only once a day.
Sit down and relax. After a while, maybe an hour or 2, take another reading. I know it will be coming down because we have a case like that about 2 weeks ago in my church. The person, they forced her to come to the clinic. At the clinic, when they did the reading, it was 190 to 135, 39. The first thing, we gave her a bed to sleep. After 2 hours, between 3 and 5 at least, it came down and went to ask her to go home and relax. Thank God the husband was around. I had to relax. Then every day she take the reading.
Do I snore at night? Check yourself in the morning. See if you are energized when you wake up in the morning. You know, you can't wake up and be tired after you've been in bed all night. You should be strong. You can't be ready to go another day. But if you are feeling tired after sleeping the whole night, you need to ask your wife, do I snore? Am I snoring? If they say you are snoring, go and do that sleep study. And if it's confirmed that you have what we call obstructive sleep apnea, then you have to go on the treatment, which is basically CPAP. We use the CPAP machine, which basically is something you put in your face, covers your nose and your mouth, and force air so that you cannot obstruct. You know, because the sleep apnea comes, apnea is you stop breathing. You know, you become apneic, you stop breathing. And we say obstructive sleep apnea when it happens while you're sleeping. And the CPAP machine, I think there should be a picture. I put a picture somewhere of that CPAP machine. If not, I'll get it and show it to you. I have one of them that I use myself. Diagnosis relies on repeated measurement of blood pressure. In other words, you know, monitor your blood pressure regularly, have multiple measurements, and management. We talked about this already. Lifestyle, pharmacotherapy, adherence to your therapy helps to improve the outcomes. Early individualized care reduces complications. Yes. Reduce stress, avoid alcohol. Don't avoid excessive alcohol. That's what I meant to say. Excessive alcohol. So 1 for the ladies and up to 2 for the gentlemen. Cut the fat. You know, so Laura is not good. You know, try and stay away from it. Morning walk. We did our morning exercise this morning. And reduce stress. You know, cut your expenses. You know, if you can only afford to live in a duplex, fine. Live in the duplex. Don't look at prof that is living in an estate, controlling one whole estate. Duplex is what you can afford. Or even if it's a flat, you know, room and parlor self-contained. Be contented. You know, one of my very good friends that we grew up together always tells me something. They say, Femi, 10% in the charity me. So I start the year, I say my salary is $100,000. So I said $10,000. I don't give it to church or mosque. I give it to my friends as charity. However, if that 10,000 finishes by March of the year, if my friend comes in April or YOLO, wow, you have to wait for the next year. And he's done that, it's worked for him. You know, so that's a way to deal with stress. Because I know all of us, we want to help. You know, we want to help our brothers. We want to help our family members. But the resources are limited. So you do what you can. You know, you do absolutely what you can. And just to explain to the person, a good friend, a good family member will understand if they come to you for 1 million and you say, I only have 100,000. Or they come for 100,000 and say, I only have 10,000. That's all you can do. You know?
Just shout, yay! And we rush him to the hospital. So by the time we rushed him to the hospital, it was confirmed a bit hypertension. that just like he had, how do you quickly attack it so that it won't reoccur again? Thank you.
Thank you, Prof. So that's an interesting case. Somebody screams, ha! I guess they were holding their head too. So it looks like a very bad headache. Okay. So there is what we call subarachnoid hemorrhage, where you get a severe headache caused by very high blood pressure, results in rupture of the blood vessels in the brain, you get a stroke. I imagine that's probably what happened to this gentleman, because he screamed. We usually say that is the worst headache of your life. I mean, they've described it as if they take one big hammer, somebody go, pow, in your head. Headache that you've never had before. So, I mean, that person obviously had high blood pressure. They have not interacted with any doctor to measure it, and the body has been suffering for a long time, and it got to a point where there was actual damage done. Unfortunately, when it happens like that, you just have to manage the blood pressure, control it, and then do rehab. So medications to control the blood pressure must be taken. Lifestyle modifications, alcohol, smoking, exercises, salt reduction, all that has to be done, and physiotherapy, exercises to try to rehabilitate the damaged nerves. It takes time, but some people make full recovery after a stroke. You see them a year later, there is no residual deficit that you can see. Others will never recover fully, and you see them when they go, because it affects half of the body. Some people never make full recovery. And probably the worst thing about stroke is there is what we call mini strokes. We call it TIA, or transient ischemic attack. Before you get the massive one, sometimes God will send you warnings. You get that mini strokes. You have a deficit that lasts 10 minutes, 20 minutes, and you make complete 100% recovery. There are mini strokes. At times you go to the hospital, by the time you get there, the doctor will be looking at you like, what did you say happened? Doctor, I just lost the ability to speak. My face was drooling. I couldn't carry my leg and my arm. And the doctor looks at you like, but there's nothing wrong with you. There's nothing wrong with you. Everything is fine. They do the CAT scan, they do the MRI. Perfect. Nothing wrong. You have made a full recovery. However, that's a warning sign. If you get a TIA, a stroke is on the way. So that is the time for you to control your cholesterol, your salt, control your blood pressure, and make sure everything is okay, because you will get that stroke if you don't do it. Any other questions?
At what age do we really have particular age that we must prevent this hypertension? Sometimes because we have experienced series of human beings, haven't retired, spending 35 years, or they are at because of their age, they have to be retired. Then within 1 year, they became hypertensive patients. So what age is it appropriate that this thing must be well constantly monitored in order not for it to reoccur? Thank you.
Thank you, Prof. Age of development of hypertension varies. Like you said, there is some genetic factor involved. Some people will get it because their parents have it. Other people just develop it because of their lifestyle. I've seen very young people with high blood pressure, as young as Richard. I think the key thing is ifralogun. Do regular annual medical checkups. We have physicians in our midst. There is Dr. Akikomi, Dr. Emeka Nzewi, and myself, that I know that are practicing physicians. Do those tests, share it with your doctors, share it with your friends who are doctors, get a second, third opinion on what to do, and keep doing it. The investment of maybe 10, 20, 30, 40, 50,000 naira once a year, I think is money well spent, because at the end of the day, all our suffering, we should live long in this world to enjoy the benefits of our labor, and we should take care of ourselves. I know we want to take care of our children, but we must also take care of ourselves, because at the end of the day, our lives are and our children will look after us. But newsflash, they will take care of themselves and their wives and their children before they think of us. Are you getting me? A lot of us will deprive ourselves because of our children. I think that is wrong. You must take care of yourself first, before you care for other people. When you're flying in the plane, Prof knows this. They will always tell you, if there is a problem, put that mask on yourself first before you put it on your child. Put it on yourself first. Why? It is when you are standing and okay that you can help somebody else. But in Africa, we don't do it like that. Too. My father will not eat. So whatever is left in the pot, that is what he will not eat. Yeah, the one that bring this money, you should chop first. But no, they don't do it like that. Ekran, you have a question. I answered the question, right?
In Domino.
Confidimos.
Yeah. I happen to know or to have some people around me who are on hypertension medication. Doctor, please, you need to hear this. Please, you need to hear this. So what I notice is that many of them that I know that are on this medication, they sleep a lot. I asked them, is it the drugs that makes you sleep? They said yes. So that means that if I sleep very well, it can curb high blood pressure. Is that, doctor? Did you hear?
I heard you. I'm going to answer you. So his question, Ekoriawole would like to know, why is it that people on blood pressure medication sleep a lot? So I don't know the answer to that question. I'm going to be honest with you. Why do they sleep a lot? I do know if your blood pressure is low, you may feel sleepy. You may feel sleepy if your blood pressure is too low. So they should probably be checking their blood pressure. The common side effects that people have told me about is they feel tired, and some people say it decreases their libido, the drive. I've heard that a lot. But whether they are sleeping, I guess they can sleep because they are feeling tired. That may be the reason why they are sleeping. Yeah. I mean, like, it could be because they get tired. And they could be getting tired because their blood pressure is lower than what it used to be. So I said, if your blood pressure is usually here, right, that's what I'm saying. If your blood pressure is usually here and you bring it lower, there's decreased perfusion to the brain and you can feel sleepy. You understand? So maybe I have to research that more, But people have not told me that they are sleeping more. They usually say they feel tired, Right. Well, I mean, all those drugs have side effects. Prof probably knows that. All of them, including paracetamol, there's side effects. You know, if I take paracetamol or Tylenol, I will sleep. I will sleep as if I've taken a sleeping medication. Any other questions? Let's get Apostle.
Indomino.
Confidimos.
The first question I want to ask is, most cases when you go to maybe pharmacy or you go to your doctor to check your BP, sometimes it asks you to take off your clothes. Sometimes they use it straight on you. The perfect way of getting the right measuring of BP is it by having your clothes on. Some even ask you to take off your wristwatch so that they can get an accurate reading. Does it all the same works with taking your clothes off or using your beer? And the second one is hypertension in children. That was the day I was visiting my doctor, and a girl of 15 thereby was being diagnosed having BP. So I began to wonder what would have happened to a 15-year-old girl running this high blood pressure. So I want you to help me to. Thank you.
Thank you, Apostle. So I'm going to take the second question first. Like I mentioned, the most common type of hypertension is the primary essential hypertension, which we don't know why. And you don't see that in young people, usually. Most of the hypertension you see in young people are secondary hypertension. In other words, there's a problem in the body, you know, in the adrenals, you know, kidneys, maybe even liver, can have high blood pressure. You know, in which case you treat the reason why they're having high blood pressure. You know, in terms of the proper technique for blood pressure measurement, doctors sometimes will feel rushed. Most of the time we don't take blood pressure, our nurses do it. And, you know, depending on how many patients you have to see for the day, they can cut corners. Ideally, you should be seated, undressed, your watch off, back resting, feet flat on the ground, legs not crossed, and you should have rested for 15 minutes after you arrive before they check your blood pressure. But they don't do it like that because of time constraint. They want to rush and quickly do it, go to the next patient. Rush, quickly do it, go to the next patient. A lot of times when I'm in the hospital, I'm in the physician call room, nurses will call me and say, "Doctor, this blood pressure is this." I say, "How did you measure it?" They use the automatic machine. I say, "Okay, do me a favor, check the cuff size, make sure it's appropriate, and then do it manually before I prescribe any medication." Manual one. Before I prescribe medication. And a lot of times, if it's not too crazy busy in that hospital, I will actually take the elevator, go to that floor, walk into that patient's room, and check the blood pressure myself. Because like I explained to you, the worst thing you can do to somebody is to give them low blood pressure. High blood pressure is not good, but it's not as bad as low blood pressure. So hypotension is the worst, like Prof said. It's the worst. It's the worst. So if you don't need to treat, then don't treat it. Make sure the measurement is real. Otherwise, you just go and lower somebody's blood pressure. Their grandmother will get up from the bed. Boom, what is she? Keep right. Never recover. That's how she will die. Thank you. Korean,
We have to thank you for putting us through this. There are 3 questions I want to ask, but Majeko Dumi has asked something similar to it. I want to ask, which one is the correct measuring arm between the left and the right? Because most of us have these machines at home. Personally, I feel the left gives accurate. But when I go to another hospital, they say, no, you can measure either of the 2 arms. That's question number 1. Question number 2, most times we have been told that it is the high blood pressure that spoils the kidney. In the same vein, someone saying it is the kidney that spoils, that causes high blood pressure. I want you to please expatiate on that. We monitor carefully in order to spoil the other. Then we were told anyway from from Grapevine that high blood pressure drugs cause erectile dysfunction. But you said something similar, but I didn't hear proper. So I want you to, does high blood pressure cause erectile dysfunction? Those are the three questions.
Thank you, my brother. Indomilo. Okay, so first question has to do with the technique of taking blood pressure. And you go to some doctors, they use your right upper extremity, and you go to another doctor the next day. The answer is you can use either or. I tell all my patients, check on both sides. So if you do it on this one today, tomorrow go to the other side and do it and be comparing it. Because, you can actually pick up a problem if there is too much difference between the blood pressure. There should not be significant difference between what you measure here on the left and the one you measure on the right. Okay, so that answers that. The next question has to do with the side effects of some of these drugs. I've heard from a lot of patients, and if you read the pamphlet inserted into the drugs, one of the side effects is ED, erectile dysfunction. And that actually makes some people stop taking it. Some patients will tell you, doctor, I'm not taking that drug again. Not taking it. I don't like the way it makes me feel. And you have to kind of look for something else that has lesser of that side effect. Because there's no point prescribing medication that your patient, you can't force patients to take it. You just write it on a piece of paper and say, okay, take this in the morning, take this at night. You just not decide. When you go, so you haven't done anything. So you have to work with your patient. You have to get them to buy into the therapy that you're prescribing. Okay, so that's that. ED is a common side effect. And I think the high and low. Okay. What leads to one? Is it the chicken before the egg, or the egg before the chicken? So the fact is, high blood pressure can damage the kidney. Bad kidney can lead to high blood pressure. So you find a lot of people that are on dialysis. It's because of high blood pressure. It's because of high blood pressure. We all start with normal kidney. Most of us. Some of us have congenital problems with our kidneys, right? But almost everybody, 99%, have normal kidney that functions well. But over a period of time, they become damaged. Some have some genetic kidney diseases, that manifest and damages their kidney over time, and they will have high blood pressure. You have what they call polycystic kidney disease. Any other question? All right. So with that, we have come to the end of the lecture. I'll hand over to my chairman, erudite prof.
Right. Let's put our hands together for our dynamic president, who has given fit personally to make sure that the gap is closed, because the guest speaker who happens to come here, like I have said, could not make it. So the president now took it upon himself, because he is also a medical practitioner. Once again, we say we thank you, and God will continue to strengthen you, more wisdom, more knowledge. Thank you. So now, we have had our lecture, and I believe some of us will be preparing for GMA's service. And based on Okay. No, no. We have a place. We have a place. That is it. You know, when I was briefing my colleagues about today's program at the restaurant, I made mention that we have written to a particular organization well known as More Plantation, and we gave them 11 a.m. and they have reached back to us. They have reached back to us that they are waiting for us because today is the only day that we can do that. Tomorrow there is no time because lecture tomorrow is also 1. Then we start preparing for the Ghana Light, which may, of course, be a day of enjoyment. Though tonight we are still coming back later in the day after our dinner. We have a soon night at the bar here. The DJ is going to be on standby. Then provision for beer as per our budget. Yes, we should know as per our budget. Yes, if you know you can support, it's allowed. You can see the financial secretary. He will do the needful. You understand that? Because we don't want to, at the end of the day, have a deficit budget. You understand now? Where, of course, we'll be running a task. Basically, the president